RWJ Barnabas Health, our mission is simple. We partner with our communities to build and sustain a healthier New Jersey. So when we talk about partnering, it's partnering with events like this, partnering with FinFest. When we talk about the health of New Jersey, the health comprises of so many different factors. We're talking about physical health, emotional health. We're talking about access to food, transportation, but we're also talking about economic health.
Community engagement activities in the community strikes up a lot of trust. It's not waiting for our community, our residents to come to our hospitals or healthcare centers because they are sick, but it actually establishes a relationship inside of the community.
When we talk about community health, today is a perfect example about that, bringing healthcare, education, and services into the community, alongside with Prudential, who's bringing financial services. D-Free Movement brings together both financial and health services to connect the dots.
Education is important in diabetes because you need to understand the disease process. You need to understand how your body is responding to it. And without that understanding, it's very difficult to control. Once it's uncontrolled, then you're developing complications, developing problems. You're going to lose time from work. You're going to lose time from school. So it's going to have an impact on you financially if you can't produce for your family because you're out sick, or you need to go to doctor's appointments, so on and so forth. So that does have a significant financial impact.
We know the most expensive part of the grocery store are healthier items like fresh fruits, fresh vegetables, lean proteins, fiber-rich whole grains. And that's where we're spending most of our dollars in the grocery store. So sending that message that financial wellness equals health and wellness, I think is really important. Those everyday food choices that we make, those are the ones that are impacting our health over time and really are our risk for chronic disease, things like diabetes, cardiovascular disease, obesity, and all of its complications. So by being able to really own our health and wellness with the choices that we make at the grocery store and those everyday decisions, it helps empower our health long-term, which is going to impact our financial health and our financial wellness long-term.
If you can't afford housing, or if you can't afford your utilities, or even your medications or food, for instance, we want to make sure that we give you the resources to have the ability to do that. So today we're doing that with our CHW team. We learn more about what those needs are beyond the typical ones that we think about, and finances are one of them. So with our partners here from Prudential, we're able to provide those resources as well.
RWJ Barnabas Health has made a commitment to health and not just treating sick people. And the healthcare industry has got to learn what RWJ Barnabas knows, and that is that the mission of healthcare is not only to wait until people get sick and treat them, but to help people avoid illness, which is a holistic approach to healthcare.
I'd like to thank Reverend Soares, the visionary founder of the D-Free Financial Freedom Movement and a valued member of the RWJ Barnabas Health Corporate Board of Trustees, for creating a platform that truly uplifts our communities.